Good day, good day. Welcome back to Canute Exploration, your topic in a podcast. One of the things that I'd like to share with you today is the four evils of sex. We are going to be talking about the four evils of sex in the context of sexual dysfunctions and those four main sexual dysfunction that are for sexual disorder that people encounter. You'll hear people talking about, um, and it's more prevalent than the four most prevalent ones. Um, Look, we are going to be defining this sexual disorder concept, sexual dysfunction concept. But we must also understand that there are causes to sexual dysfunction. So we're going to be looking at that as well, right? We are naturally going to be looking at the types, those four types of sexual dysfunctions that I call the four evils of sex. And something that many of us as psychotherapists / psychologists often wonder how much of a thin line there is between mental illness and sexual dysfunction. I'm Canute White, your host on Canute's Exploration. And if you stay with us, you'll learn a lot about these evils of sex. Let us consider first the definition of sexual dysfunction or sexual disorder, if you may, because the term interchanged, by several persons. But sexual dysfunction really happens when there's a problem that prevents you from wanting or enjoying sexual activities. So sexual dysfunction is as simple as that. There's a challenge or challenges that prevents you from wanting or enjoying sexual activities. This can happen anytime. This can happen anytime. Men and women have challenges with their sexuality, their sexual activities. It's not a man thing. Women also have challenges or experience sexual dysfunction throughout their adulthood, and it can happen at any age, right? And we have to understand the challenges that actually surround this sort of calamity that many people experience. But as you increase in age, the chances of you experiencing sexual dysfunction increases, right? Those chances increase. So the definition of sexual dysfunction, according to Headline, is really you having problem that prevents you from wanting or enjoying sex. But let's look at these four evils. These four evils are very important as you because there there's this type of challenge that we'll have as it relates people have as it relates to desire of sex. There there are persons who do not have desire for sex, and this is a critical sexual disorder that is not being talked about, like all the other sexual disorders. But people talk about erectile dysfunctions, impotent, and tense, and so on. But desire disorder is one of those sexual disorders, sexual dysfunction that needs to be talked about. And desire disorder is really the lack of sex drive. The lack of sex drive. There's no desire for sex. There's no desire for this pleasure we call sex. And when individuals do not have a desire for sex, it's really a sexual disorder, a sexual dysfunction that individual or those individuals are experiencing. So that was the desire disorder. Hey, I don't desire, you don't desire sex. That's the desire disorder. There's no there's no there's no interest. There's no there's no drive for sexual activities, sexual intercourse. So that's what psychologists call desire disorder. And the North Shore University health system is where we're taking these definitions from as it relates to these disorders. So with the desire disorder, right, you find that persons will be in a situation to be engaged in sexual activities, but there's no real desire. Like you desire a meal, there's something that you desire, something that you have an interest in, a drive for, right, motivated for. But with desire disorder, you are just not motivated to have sex. You're just not having an interest in sex, right? Despite the environment being susceptible for sexual activity. So that was one of the disorder that we call evers of sex. The other one is the arousal disorder. The arousal disorder, you might have guessed, the individual is in a situation where he or she can be aroused or should be aroused based on the environment, but there's no arousal despite the intimacy, despite the romantic moment. There's no arousal. So that is another evil of sex, arousal disorder. And this arousal disorder is something that many people that have been suffering from, and it simply means that during petting, during romantic moments, they're just not aroused because there is a challenge, with this sort of the arousal aspect of sexuality. And this arousal disorder, right, also means that the male in particular have what we generally know as erectile dysfunction. So erectile dysfunction is really a type of arousal disorder. And erectile dysfunction simply means that there's a lack of blood flow to the genital of the male, right? And remember this, women can also have sexual dysfunction. We said that, right? It's a male and female thing. And the arousal disorder presents itself in the female through lack of lubrication and pain during sexual intercourse. So, arousal disorder is that other evil of sex. The third evil of sex that would like to consider is the whole thing about orgasm disorder. And this orgasm disorder, which is mostly a disorder that women have challenge with, is that evil of sex that makes it difficult for the female to reach climax. And naturally the female would want to be able to reach climax to enjoy, right? Or to have enjoyed the whole sexual activity. So the orgasm disorder speaks to that difficulty of reaching your climax, right? And look, guys, this is Canute Exploration, your topic in the podcast. I'm Canute White. And what I'm saying to you is that there are sexual dysfunctions out there. More than 4, but these are the 4 main ones, that common ones. And eventually we'll talk about more in subsequent episodes. But these are the most common ones. And I call them the 4 evils of sex. 4 evils of sex. And the fourth one is also common for women. And that one is basically called pain disorder. Pain disorder, as the name suggests, is basically the female having pain during sexual intercourse continually, right? Having pain, and it become a sort of a pathological scenario for the female. Healthline define this as basically pain during intercourse, right? And that's a critical aspect of female sexuality that need to be addressed and talk about. We are not, sex and sexuality had become so much of a taboo, and hence, we at Canute Exploration are looking at sex and relationships in a more wider context. So, you can learn and we can have discussion as it relates to our sexuality. So these 4 evils of sex: desire disorder, lack of sex drive, arousal disorder, difficulty becoming aroused during sex, and erectile dysfunction and lack of lubrication in men and women respectively, suggests that sort of arousal disorder. Orgasm disorder and pain disorder. These are the 4 evils of sex. Look, guys, sexual dysfunction, as we have said, are basically the things that prevent you from enjoying and having interest in sex. But what causes sexual dysfunction? What causes sexual dysfunction? Let's look at that for a while, right? Healthline made a number of suggestions as it relates to the causes of sexual dysfunction, and Healthline suggested also that it affects both men and women and of all ages, right? It's not only a senior citizen thing. Yeah, it affects persons in their 20s, and I've had clients who have challenges in their 20s, early 20s, and it shows that it doesn't have anything to do with age or sex, meaning gender, meaning sex, gender. There's a difference between sex and gender, right? Gender is more psychological, behavioral. Sex is biological, but that's a different that's a different matter. All right, there's this sort of distinction between sex and so sex has to do with the whole biological setup, and gender has to do with the behavioral. Because a man can behave as a gender, a female gender, and a woman can behave as a male gender. So that's a different matter. But what I'm trying to say to you is that it doesn't matter if you're a man or a woman or any age, you can be affected by sexual disorder or dysfunctions. So what are the causes of sexual dysfunctions, sexual disorders, as described by Healthline? Sexual trauma. Sexual trauma can cause sexual disorder, sexual dysfunction. And these sexual trauma, it speaks to females who have been raped, and it can create this psychological mindset, this psychological impact on the female, unless they have gone to trauma counseling, right, to deal with that post-traumatic stress disorder and so on. Then there might be a level of sexual dysfunction, sexual disorder. And I tell you, mothers, it's important for you to understand. And those of you who know me know that I am a psychotherapist / psychologist. I have degrees in psychology. I've been lecturing in psychology for 15 years or more. Well, I lectured in psychology at the university level, and I have had a private practice back home as a counseling psychologist. So I am in tune with the psychology thing, right? And the thing about it, mothers, be careful how you would want to expose yourself to your sons, right? As teenagers, as a child, right? That may also create a challenge as it relates to sexual dysfunction. So if you have been doing that, stop. It can create this sort of a picture, a footprint in the child's head, and affect the child's sexuality later on, and create sexual dysfunction. So this whole thing about sexual trauma can create sexual dysfunction, right? And rape is one of those trauma, and exposure to sexuality, other form of sexuality, can create this sort of trauma, right? So that's a very critical component of the causes of sexual dysfunction for both men and women, right? So let's extend this sexual trauma from rape to sexual abuse, right? So let's generalize it. Sexual abuse, especially those within the family, incest. Those are some of the things. And look, guys, look, family, do not sexually assault members of your family. Fathers, do not sexually assault your daughters, stepdaughters, sons, stepsons. Those are some of the things that can create this sort of a sexual dysfunctions later on in their lives, right? It's a wrong thing to do, and it can also affect the lives of the victims. Psychological issues are the other thing that can cause sexual dysfunction, sexual disorder. Yeah, psychological issues, meaning even those outside of the realm of sexuality. Depression and other psychological disorder can cause sexual dysfunctions. That's what I'm saying. So, if you're not psychologically well, you can have arousal disorder, desire disorder, in particular. Well, pain disorder, if the arousal, disorder, has been activated. But psychological issues, psychological challenges that you have in your life can create sexual dysfunctions. And that is why you have to ensure that you are psychologically okay to enjoy sexual activities, right? So put it this way: in relationship, if you're having this quarrel thing, this challenging thing, and that is why many females would say, hey, as soon as we have this argument, then he wants to have sex and I'm not in for it, because psychologically their mind not there. They want to resolve the challenges, the issues that were the subject of the argument. Resolve that first, guys. That's important to the females, right? So that's critical. I mean, male and females are wired differently, and it's something that has to be understood, right? Diabetes is another thing. Diabetes can cause sexual dysfunction, right? The doctors will tell you that, and the whole intricacies and anatomy of the system. Then naturally the whole medical challenges, concerns, right, will be impacting the sexuality of the individual with living with diabetes. So diabetes can cause sexual dysfunction. Heart disease, and other medical conditions, naturally so, right? Drug use, drug use, drugs use. Stay away from the drugs if you want to have a good sex life. Stay away from the drugs if you want to have a good sex life. Alcohol is considered a form of drugs, and I see where it's also said that the alcohol use can also create sexual dysfunction men. So reduce the intake of alcohol. And a lot of times people see alcohol as an aphrodisiac, right? Something that arose this desire and drive for sex, and it's important for us to understand the impact of alcohol and drugs on our sex lives, the negative impact. Certain medications as well causes sexual dysfunctions. And I usually say to my clients who are being severely affected by sexual dysfunction, but they have to take the medications because the medication help with the medical condition that they're having. Go back to the doctor. Ask the doctor if there is a different brand of the medication that can be used, because it seems as if different brand of medication affect sexuality differently. Some might not affect it. So it has to be noted that the doctor could change the medication. Just like with many of my clients, especially the children that I used to I'm not seeing children anymore. It's more a more adult counselor. But I usually say to the parents, hey, it's not working for the child, or the side effects are too intense for the child, go back to the doctor, ask the doctor to change the meds, right? As you know, psychologists, psychotherapists are not able to prescribe medications. It has to be a psychiatrist who is a doctor, right? Or a medical doctor, general practitioner who can prescribe that. But psychologists and psychiatrists are not prescribers of medication. So, sorry, psychologists and psychotherapists, right? We don't prescribe medication. So these are the things that cause sexual dysfunctions, and these are the things that need to be considered. But if you found that you are having challenges, right? You found that you're having sexual dysfunction challenges, the best thing to do is to talk with your doctor, your psychotherapist. Say something. And as I had said to you, there is, in my mind, as a trained psychotherapist / psychologist, there is this thin line between sexual dysfunction and mental challenges. So, in our series of sex and relationships, we're going to be talking more about sexual disorders, right? We're going to be talking more about some of the behavioral challenges that connects sexual dysfunction to mental illness. They are, trust me. You ever hear about exhibitionism? Yeah? This whole exhibitionist thing, these are mental challenges, abnormalities in individuals that creeps out through sexual dysfunctions, because many persons are aroused by some of these behaviors. We'll look at those. So you need to continue to listen to these podcasts, because we'll be coming up with some of those, right? Look, this is Canute Exploration, your topic in a podcast. I'm Canute White. As usual, it's nice talking with you because I really feel like I'm with you. I'm talking with you. I'm having a conversation with you because that is critical, right? Continue to watch on YouTube, our YouTube channel, Canute Media. Continue to listen our episodes on your favorite podcast platform. Share it with a friend or friends, preferably. Share with others. Comment, leave your comments on YouTube comments section on your favorite podcast platform. Rate on YouTube. Give it that thumbs up. Rate on your favorite podcast platform. Most importantly, subscribe on YouTube and on your favorite podcast platform so that you know when we are ready, when we come with something else to inform you, to educate you, to entertain you in some aspects. Because Canute exploration, your topic in a podcast cares about you. So we care about your relationship, we care about your mental health. We will continue to give you the best, give you topics that will interest you. You don't know what will come with next. Could be topics in psychology, education, politics, anything trending. But we'll be with you again. Continue to listen to Canute Exploration. And hey, we're still in a pandemic. We're still in a pandemic. COVID-19 pandemic. Wear your mask. CDC here in America asking that we double the mask. Wash your hands. Keep your distance. Hey guys, I am pro vaccine. Take your vaccine. Take your vaccine. This has been Canute Exploration, your topic in a podcast. Thank you for listening. Join us again next time. Bye-bye.